So this is chapter 34, the impact of periodontitis on systemic health. So earlier we talked about chapter 16, the effects of health or the risk factors that health pose on periodontitis. And now we're going to talk about how the impact periodontitis has on systemic health. So there's something called association and causation. Association indicates there is a relationship or connection between two or more variables. It does not explain why or how the variables are related. It does not mean one variable causes the other. There's just a relationship between the two. And causation means that one variable is certain to cause another variable. So causation between periodontitis and systemic disease. So we're going to talk about the causation, which again, as we described, means that one variable is certain to cause another. So available research is unable to prove causality between periodontitis and systemic diseases. Based on available research, it is not possible to prove causality between periodontitis and systemic disease, but it is possible that the association is the result of common risk factors, not causality. So in other words, common risk factors could show that there's an association. How? Or the fact that they don't cause, one doesn't cause the other. Systemic disease may increase the likelihood of periodontal disease, or chronic oral infection may have an adverse effect on systemic health. So this is a matter of like which one's affecting which. Is the diabetes worse because the patient has periodontitis? Or is the periodontitis worse because the patient's diabetic? Mechanisms that link periodontitis to systemic disease, there are three: metastatic infection, inflammation, and immune response. So let's look at each of those separately. Metastatic infection, an infectious disease mediated by microorganisms that have originated from a distant body site. So you've heard of like metastatic cancer, where a patient who has like metastatic breast cancer, where it metastasizes or is found in another body site, like the lungs, it metastasized from the breast to the lungs. Periodontal infection is not limited to the periodontium or even the oral cavity. So bacteria from the periodontium are not limited strictly to the oral cavity. Oral bacteria from periodontal lesions and the DNA of periodontal pathogens can survive in the bloodstream and adhere to non-oral body sites causing infections. One of the ways we kind of already knew this for over the years is that patients who have had joint replacements, they believed the bacteria, when you are doing a prophy or perio maintenance, the bacteria from the mouth are entering the bloodstream when you have bleeding, enter the bloodstream and circulate around the body and would end up at the defective joint, causing infection. Now, most of the time, your body can fight that kind of bacteria and your host response will react, kill off those pathogens, and it will not cause an infection. Inflammation. Infections in periodontal pockets disseminate inflammatory mediators to the bloodstream and trigger inflammation. Pro-inflammatory mediators produce locally inflamed periodontal tissues, disseminate into the bloodstream, and have a systemic effect. This is one thing that they're studying a little bit more of, is the effect that your bacteria can have on inflammation in other parts of your body when it travels around the bloodstream. And then your immune response. In chronic periodontitis, bacterial antigens are processed and presented to the body's immune system and recognized by lymphocytes. Your host immune cells secrete pro-inflammatory mediators, and the increased circulating pro-inflammatory mediators associated with obesity, diabetes, and periodontitis. So systemic conditions associated with periodontitis. These are some examples: atherosclerotic cardiovascular disease, adverse pregnancy outcomes, diabetes, and several others. Dental biofilms. Subgingival plaque biofilms provide a large and persistent source of periodontal pathogens to the host. Let's look at atherosclerotic cardiovascular disease. That includes this group right here of different types of vascular diseases. You've heard of most of them, if not all of them. Research findings associate severe periodontal disease with cardiovascular diseases. So inflammatory mediators and host response play an important role. Blood vessels and arterial walls are challenged by the inflammatory mediators. Plaque biofilm provides large source of pathogens and pro-inflammatory mediators that enter into the bloodstream. So you've got plaque biofilm, you're cleaning the patient's teeth, the bacteria from the biofilm enter the bloodstream and trigger an inflammatory response within the blood vessels because the bacteria is now in the bloodstream. There's something called C-reactive protein, or CRP, that's produced during the acute inflammation. And there's a test that is done during blood work that can be done called the CRP test, in which they test the level of C-reactive protein present in the blood. And higher levels of C-reactive protein are associated with cardiovascular diseases. Periodontal infection may contribute by inducing a local immune response, elevated systemic antibody responses. So your periodontal infections can cause a host immune response within the vessels. And this just explains a little bit more about how periodontal disease affects. The periodontal infection contributes by increasing levels of fibrinogen, causing blood plasma to gel. So in other words, it can cause clotting. So dental hygiene implications: you should educate your patients at the risk for cardiovascular disease about the possible impact of the periodontal infections. So educating your patients, talking to them a little bit about how these pathogens can affect cardiovascular disease. Adverse pregnancy outcomes is another one. So you're going to want to talk to your pregnant moms. There's an association, a modest association, for low birth weight babies, preterm babies, and preeclampsia, which is high blood pressure and protein in the urine. Most likely shares additional risk factors like tobacco and alcohol use, or obesity and diabetes. So what they're saying is that it's more likely that if the patient shares these other risk factors, that's going to increase even the association. How is periodontitis related to adverse pregnancy outcomes? Pregnant women with severe periodontitis may develop bacteremia more frequently, exposing the fetus to aggressive pathogens. And of course, that triggers the immune system. And now we've got pro-inflammatory mediators entering the bloodstream and triggering systemic inflammation. So inflammation in the blood vessels. Dental hygiene implications: educate your patients about the risks. Diabetes and periodontal disease, a two-way relationship. It is clear that diabetes increases the risk for and severity of periodontal disease, but periodontal disease may exacerbate diabetes. Periodontal disease may impact your glycemic control, or in other words, your blood sugar levels. And this just illustrates a proposed pathway. You've got your periodontal infection, increased pro-inflammatory mediators. So now we've picked up the inflammation. They travel around in the bloodstream, increases insulin resistance, causing poor glycemic control, and that causes diabetic complications. Educate your patients with diabetes about the impact that the periodontal infection may be having on their diabetes. Risk factors for pneumonia. So the risk factors for pneumonia are a little bit more We're talking a little bit more about like hospital-acquired patients that are bedridden or have very compromised lungs and immune system. So the risk factor is serious inflammation of one or both lungs, community-acquired or hospital-acquired. Community-acquired are contracted outside of a hospital setting. Hospital-acquired are contracted during a hospital stay. And then there's ventilation associated acquired after intubation. We're hearing so much more about intubation with COVID now. Hospital-acquired pneumonia results from organisms called potential respiratory pathogens. They colonize from dental plaque, and then they can travel down into the oral pharynx and increase the risk for pneumonia. Evidence suggests that improved patient self-care and frequent professional care reduce respiratory diseases among your high-risk elderly patients in the hospital and assisted care facilities. So this is more important when you're talking about patients that are like nursing home patients, and usually this would be in conjunction with other or interprofessional, other professionals. You would be working with the nursing staff probably in a long-term care facility on these kinds of infections. COPD is common, chronic obstructive pulmonary disease. You will have a lot of patients that you will see over your years that have oxygen that they take with them when they come to appointments. They are at high risk for lung infections. Their breathing is severely compromised. Kidney diseases, patients with chronic kidney diseases. The complex pathogenesis of chronic kidney disease makes studies of the role of periodontal disease challenging. So these are going to be your less healthy patients, the ones that have more intense diseases. Again, probably going to be in your nursing facilities, keeping in mind that oftentimes patients that live in nursing facilities will come to your practice. Risk factors for rheumatoid arthritis, which is an autoimmune disease. We discussed earlier about how autoimmune diseases, your immune cells attack itself or yourself. They recognize yourself as being a foreign body. Risk factor for cognitive impairment, noticeable and measurable decline in cognitive abilities, including memory and thinking skills. Evidence is weak for a connection between periodontal disease and cognitive impairment, but it's something that they're just starting to kind of look a little bit more into. Risk factor for obesity, risk factor for metabolic syndrome, kind of, again, not as common, but they can be risk factors for these diseases.